I'm Mansi Bilani. I'm the fitness nutritionist and working for the Hairline International Clinic. I have around 8 years of experience in this field, and I've done my graduation from Mumbai University. And right now, I'm doing a job in the hairline and focusing nutrition for the hair and skin, and so that people they look good and it's easier for them to follow the diet and nutrition.
Is Bani, and I represent a company called Hairline International, which is a chain of hair and skin clinics. Today the subject we're basically covering here is specialization in trichology and what are the various specializations we can offer in trichology, whether it is geriatric, which means dealing with an age group of 60 years and above, and those patients basically typically facing hair loss and who are 60 and above typically. So that is one. Second, we also have, say, gynecological related hair loss patients, and where we would like to manage them holistically with keeping in mind not just a dermatologist but also a gynecologist, a nutritionist, and keeping counseling in mind. So we have all these specialities that we're bringing in together to deal with patients who have gynecological or gynecology related problems, whether it is perimenopause, menopause, postmenopause, postpartum hair loss, and similarly PCOS and things like that. So that would be like typically managing patients who have hair loss belonging to this group and this stream of science. Then we also have pediatric, which means that we would be looking at managing small kids under the age of 16 and provide specialized care, keeping a pediatric dermatologist with us who will manage them more from the pediatric point of view, more from the child sensitivity point of view, and correct management, medical management point of view. So that would be the pediatric stream of trichology that we've introduced. Besides that, we have the endocrine, which means endocrine related hair loss. So what we've done is in conjunction with the endocrinologist who's kind of clubbed his let's say his service with us, him and a dermatologist, and we'll have a nutritionist and a counselor who probably will help manage the hormones that trigger hair loss. So that is the third science that we've kind of brought in. Then there's the psychiatric hair loss, which is actually a growing stream now, and we see a lot of people dealing with stress related issues and other psychiatric related hair loss issues. So we will probably bring all these together, like I said, in conjunction with a psychiatrist. These problems will be managed holistically so that the outcome is better, the results are better, and there's more holistic care, and let's just say we'll have a more satisfied patient going out. So that would be the fourth specialty. And similarly, so we have these 5 branches that we've rolled out, and we are hoping that we're able to basically address hair loss related to these specific groups with specialists and taking trichology probably to the next level of medical management. Thank you.
Dealing with the patients of above 60. In hairline, when they undergo a lot of procedure, PRPs or hair weaving, threading or the transplantation, since most of the elderly, they will be suffering from a lot of comorbidities, say diabetes, hypertension, maybe some other illnesses, serious illnesses like cancer also. When they having with the multiple drugs, there will be a lot of interaction between the drugs, a lot of side effects. So my core area comes to prevent or rather minimize the side effects of all these medications, or have a less side effects of all these medications, rather keep them at a lower medicines.